And my name is Marvin Brooks. I'm a 7+ year licensed agent. I'm licensed in Texas and 15 other states. So if you need any information or help finding a plan, I'll be more than happy to help you. Now, here in Texas, there are 5 different entities of health plans that are available. You have the Marketplace, which is the ACA, the Affordable Care Act, Obamacare, what most people call it. We have short-term plans available, the Medishare plans, indemnity plans, and private health plans. To my knowledge, the private health plans are the only plans that an individual can get for himself and his family that is on a PPO network. Indemnity plans, it's according on the amount and what company you deal with. The Medishare plans, they don't have networks. It's just about an amount that you pay, and then you send the rest of it in for other members to send in their share to help you pay for the end of that. And then short-term plans, they do have networks, but they're more of an indemnity also. You can have 3 months, 6 months, 9 months, 12 months, and I think there is a 36-month one out there also. The other thing I'd like to go over with you that you need to know if you're picking your own plan. Now, I would love for you to contact me and let me become your agent and help you find the best plan that fits your needs and your budget. But if you decide to do this on your own, here's some information that you should know. There are 4 main operating networks in the state of Texas. You have an EPO, an HMO, a POS, and then the PPO. Now, the PPO is the best one that you want to go for because that allows you to go to whichever doctor or choose whichever primary care doctor that you want to see and then go to a specialist whenever you want to go. All PPO networks aren't built the same. The networks are built off of the company that are representing the network, the size of the network, and the negotiated contracts upon the network. So the better the PPO, the bigger the network, and your agent that you're dealing with should know the ranking of the networks that they give you, because there's some out there that say limited benefits. There's some out there that are PPO doctor specific, which they give a bigger discount on the doctor than the facility and everything. So there are many, many different ones. The other plans that I want to explain to you is the EPO. An EPO is Exclusive Provider Organization. Now, these definitions come from healthcare.gov, so you can go to healthcare.gov/glossary and look these all up yourself also. An EPO is a managed care plan where services are covered only if you use doctors, specialists, or hospitals in the plan's network, except in an emergency. So that means if you're out of network and it's a life-threatening emergency, there is a percentage that company will still pay towards it, but the rest of it falls upon you. Then we have an HMO. Most people know what an HMO is, but I'm going to explain that also. An HMO, a type of health insurance, is called a health management organization, a type of health insurance plan that usually limits coverage to care from doctors who work for or contracted with the HMO. It generally won't cover out-of-network care except in an emergency, and an HMO may require you to live or work in the service area to be eligible for coverage. HMOs often integrate care and focus on preventive and wellness. Now, for HMOs, you also have to get a referral to go see a specialist. If you go to your own specialist or anything of that nature, you're going to be 100% out of pocket. The last one is a POS, point of service. This is a type of plan where you pay less if you use the doctors, hospitals, and other healthcare providers that belong to the plan's network. POS plans require you to get a referral from your primary care doctor in order to see a specialist. So POSs are operated like HMOs. What's the difference in them is most POS are broken down to counties, and municipalities, such areas. The other difference is you could have a hospital that's literally on two sides of the highway. One of them could be in contract with that POS and the other one can't. So you really have to know your area of what you're going to be covered under to have a POS, because if an emergency happens or if something comes up, you want to go to the right hospital.